The Digital Scrubs project aims to improve work in the operating theater in the future. Researchers from medicine, computer science, and industry are developing systems that measure the attention and stress signs of the operating team and make them visible using AI. This complex project is being funded by the Federal Ministry of Education and Research with €2 million. It aims to support the interaction between humans and machines. It arose from the specific needs of medical professionals.
One of the things which doctors have made very clear to us is that there are different stages of stress during a surgery. There might be hours when a doctor is doing a sort of simple task, when it's okay for them to be talked to or for someone to tell them something. And then there are 10 minutes when they're doing something really, really stressful and difficult, that this is not a time when an assistant or someone else should talk to them or bother them. And one of the ways we want to help the team is by making these decisions clear to everyone and letting everyone know that is inside the operating room.
The team uses two technologies to visualize and use the attention levels of people in the operating theater: biometric sensors and AI.
By that, we mean that we take a lot of measurements from the users of the system. We measure their brain waves, we measure their rate of sweating, we measure a lot of metrics that tell us about how they feel and how stressed they are. And then we use artificial intelligence to process this data and be able to have tangible insights that we give them.
The project needs a realistic use scenario as a basis. As a test setup, the team therefore developed a training box with which test persons, mostly medical students, can practice nerve-sparing surgery. This test scenario was the brainchild of a surgeon who wanted to know how his students would react during their work and whether it was possible to make it clear at an early stage when critical situations would arise. Sensors on the head, torso, and hand measure values that are transmitted to a monitor on the wall. The measured data is enriched with metadata in a map so that everyone in the operating room can understand the information displayed. For example, this could be the names of the different operators, if you want to imagine it that way. This becomes really important when several people are working in the same room and using the same devices, because then it is relevant to know who is using which device, whose pulse is very high at the moment. The system should not only make it possible to visualize when a person is particularly concentrated or stressed, but also react to encourage attention. Ultimately, we want to help the surgical staff to keep their attention levels high and give them the right input when they need it. For example, we have the Tesla suit as an assistance device. This is designed to inform employees via haptics if they might be cutting too far, for example. You can also configure how much and how little it vibrates. And of course, this also promotes attention at the moment. We also have the visual part, which means that the employee can see things on the monitor. And we also have the audio part, which means the sound is played to indicate that too much has just been cut or that you should pay more attention at the moment. Artificial intelligence is the essential component. It is what makes it possible to help people in the operating room with the gathered data. In this project, it is practically seen as a team member.
Die Vorteile von KI im Allgemeinen bestehen daraus, dass man
And the advantages of AI in general are that you have the opportunity to provide better interactions through AI.
Interaktionen dann zur Verfügung zu stellen. An der Stelle ist der große Vorteil von
AI is able to map context and bring them together.
Abzubilden und zusammenzubringen. Also die zukünftige OP.
The ideal future OR that we would like to see is an environment that can be controlled by this additional member of the surgical team.
Steuerbar ist durch diesen zusätzlichen Mitglied in dem Team, in dem operativen Team. Und der sorgt dafür,
and this member ensures that the appropriate communication takes place among staff, but also that information is made available to the respective operator in time.
Zum jeweiligen Operator zur Verfügung stellt.
Stress factors are taken into account and then supported with both information and proactivity.
Und dann sowohl mit Informationen als auch mit Proaktivität dann unterstützt.
There is still a lot to do before this can be accomplished. The researchers are currently continuing to collect measurement data. In phase 2 of the project, AI will then convert this data into tangible results. The aim is to improve working conditions in the operating theater, optimize attention, and ultimately increase patient safety.